Coming up next on It's Personal, brought to you by Gunderson Health System, the Blanket Drive is underway. You're going to learn how you can help others keep warm this holiday season. The Giving Campaign is also a way for many to give back, and locally. You'll hear more. And did you know about the Jacob Wetterling Resource Center and that it's a part of the Gunderson Health System? Have you heard about the 11 traits? Well, soon you will, because it's all next on It's Personal, brought to you by Gunderson Health System.
You know, house calls aren't typical anymore. But as a Gunderson cardiologist, I do the next best thing: outreach visits to my patients in rural clinics and hospitals. I love that I can bring care closer to home, especially when they're ill or the weather is not good.
At Gunderson Health System, our doctors go the extra mile, or 60, to provide care for patients. It's the driving force behind love plus medicine. Learn more about Gunderson hospitals and clinics at gundersonhealth.org.
Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Chris Stauffer. Well, the Blanket Drive is already underway. It's an annual tradition, and here to talk about it is Kathy Caney. She's a nurse and a nurse educator in the Department of Nursing at Gunderson Health System. Thanks for joining us.
You're welcome.
Hey, how many years has this been going? Because this has been an annual drive, and it really, I guess you could say as a pun, it covers a lot of people.
We've been collecting blankets for the last 10 years. It started in 2006, and so we're going into there's always deliberation whether this is our 10th or 11th, but regardless, it's been 10 years that we've been involved with wrapping the community in warmth.
How did it all start?
It started with a conversation with a number of nurses around a table. As we thought of an annual tradition that we could begin, we had to make it simple and yet something that was worthwhile and something that nurses could relate to. So part of everyday work for nurses is not only providing pain medication and assisting in procedures, but one of the most basic things that we provide for patients is a blanket. Every patient that comes into the hospital or emergency room, and even the clinic at times, is in need of warmth. And so nurses immediately think of blankets, and so that was something that seemed to really resonate with nurses throughout the system.
So is that really why the blankets were chosen? Is the warmth and the comfort that they provide?
Yes, it's a basic need that individuals have when they're not feeling well or they're scared, and certainly hospitalization and unknown diagnoses can produce those kind of feelings in patients, and so there's nothing like a warm blanket that provides some comfort. It's also a symbol of the nurse's care for patients.
Yeah, it's not always for somebody who doesn't have the money to purchase a blanket or have a blanket at home. It's for maybe somebody that just needs one today.
Exactly, and so over the years we have received such positive feedback from the community, and so we've continued, and not only have we provided these blankets for our own patients, we've also extended the thousands of blankets that we've collected over the years to different individuals in the community. And therefore, it really, I think, reflects well in the nursing program, but also employees throughout the system have jumped into this, and it's become an annual tradition of giving for them as well.
I've been happy to see how this is sort of unfolded for several years now, and it's really kind of neat to see that storage closet where you keep the blankets just sort of slowly build over time.
As it builds and then it empties. And so we find all the charitable organizations. We try to deliver many of the blankets before Christmas because it is included in gift bundles for different charitable organizations.
Yeah, can you talk about some of the charitable organizations that have participated, maybe in the past, maybe not necessarily this year, but can you talk about some of the places where the blankets have gone besides just the individuals?
There is a long list, and Salvation Army is one of our largest recipients, as well as La Crosse County. Many individuals are homeless or come to the community and have escaped some violent situations, come with nothing. And so we transfer the blankets that we receive as donations to their closets, so to speak, and from there they're able to distribute those blankets to individuals in need.
We're talking with Kathy Caney. She's a nurse and a nurse educator at the Department of Nursing at Gunderson Health System about the annual blanket drive. I guess we should find out, how can people donate their blanket? Do they just bring them to Gunderson, or are there drop-off sites?
Yes. It's very easy, and it's become easier over the years. We now have valet services, so people don't even have to enter the building. They can drive up and hand a blanket to any of the valet members that are here on the main campus in Alaska. But if you do come for a clinic visit, stepping right in, the service desk personnel also know, and there are bins that are just conveniently located, so they can be dropped off in the bins, and then they come up to the Department of Nursing, and that's where the redistribution starts.
What kind of blankets are you looking for?
Blankets can be new, all shapes and sizes, from infant up to king and queen size, which are often very needed. But also they can be handmade or gently used. They should be laundered when they're dropped off, but there are many people in the community that have made blanket making as part of a tradition as well, that now has their regular contributors to the donations.
Yeah, it's pretty neat to see the variety that comes in, and sometimes people bring in trunk loads full of blankets.
Mm-hmm. They have brought in a lot of the popular things are having groups make the Tide blankets. There is a class, second grade class out in Alaska that every single year parents and children jump on and buy the fabric, and is part of their seasonal giving. And so likewise, there are folks that crochet blankets all year. So even though this is the time between December and January that we collect the blankets, I do have blankets that trickle in all year.
Right. Yeah. Now let's talk a little bit about the totals, because I think people are a little bit surprised sometimes when we say how many blankets have been donated each and every year. It's not just 100 blankets or 150. You're talking, nearly 1,000 blankets just about every year that come in through the blanket drive.
Correct. I think we started at 250, and then we went up to 500 blankets the second year. And by the third year, there was a challenge that could we receive 1,000? And so every year since then, we have reached our goal of 1,000. I think one year it was just a little short of that. But for the most part, some folks generously donated some funds, and we went and purchased the remaining balance. So we've always met the 1,000 blanket goal, and so it's awesome to me to think that over the years we've collected nearly 10,000 blankets.
And a pretty easy thing to pick up at your local store if you're thinking about what you can do to donate this holiday season.
Mm-hmm. Exactly.
All right, Kathy, I know some of the regional clinics too also offer that. So if you're listening and you are, in a different community, you can certainly find out if the regional clinic is a drop-off site for you as well. Kathy, thanks for joining us.
Oh, you're welcome.
All right,
Thank
again,
you.
if you'd like to learn more about the blanket drive, you can go to the Gunderson Health System website. That's gundersonhealth.org. When we come back, we'll talk to a member of the Gunderson Health System's Foundation about how you can give in a different way. That's next on It's Personal, brought to you by Gunderson Health System.
Let's face it, when you've been in labor for 24 hours, you're not exactly pleasant. And it takes a really special person to guide you through. For me, that person was Missy.
Fabulous. You're doing great. You're doing great.
She was with me in the hospital at Gunderson her entire shift, and somehow she managed to keep me laughing. She never got irritated with all my questions and treated me like I was the only person who mattered. It's weird, but I felt like I'd known her for years, even though we'd just met.
Here we go. And...
Missy is an amazing nurse, and because of her, I am a very happy first-time mother. And she's why I'm taking classes in the local college nursing program.
Gunderson Health System uses the power of love plus medicine, making each patient experience as amazing as possible. Learn more about Gunderson hospitals, clinics, and specialty services at gundersonhealth.org.
Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Chris Stauffer. Well, the Giving Campaign is going on at Gunderson Health System. Joining us to talk a little bit more about it is Chief Development Officer Robin Takey. Thanks for joining us.
Thank you for having me.
The Giving Campaign, annual appeal, goes out at this time of the year. What's the goal? What's the idea behind the Giving Campaign?
Well, our annual year-end campaign that we conduct through Gunderson Medical Foundation each year is really an opportunity for us to reach out to all of those benefactors and constituents that have supported us in the past and let them know what we're doing in the foundation, what advancements we've made in our mission, and how they can continue to support that work. So we have a multi-channel effort. Our campaign evolves around a direct mail appeal layered by some social media. It's layered by videos, information on our website. We also conduct an email effort.
Because people want to know where the money's going.
They want to know where it's going. More and more every day, people are wanting to see the results of what they do. When I first started in my career many years ago, people trusted charities with their dollars and didn't really designate them for specific purposes or ask too many questions, but that's not the case anymore. People are really specific about how they want their gifts to be used, and they're very specific in wanting to know how they have been used. So we use this campaign at the end of the year to do both of those things.
Give me an example of how people are, I'll say, steering their money to the foundation.
Well, Gunderson Medical Foundation's mission is primarily to support our medical education programs, our clinical research and our laboratory research efforts, and our community outreach efforts that include Children's Miracle Network and global partners and things like that. So we have a very specific mission. But within each one of those mission components, there are a variety of things that people can give to. And I think that's one of the attractive things about giving to our campaign, is because you can choose a variety of different things to support. We're seeing a lot of support this year designated for cancer research. And the reason is because we have made great strides in the growth of our cancer research that we're doing here at Gunderson. It's gaining not only regional attention, but national attention. The work that Dr. Porritt Kenny and his crew are doing over at the laboratory. And that was really initiated, I guess, a lot of public exposure came with the gift of $1.5 million from Mrs. Betty Cabara earlier this year. And it's created a lot of awareness about the importance of that work. And so people are, I guess, jumping on that bandwagon, and they realize that cancer affects everyone. There's, it's in everyone's lives. And the work that we're doing is really going to make a difference in how we care for our patients here locally and regionally.
And I know there are many individuals who want to donate to the foundation on behalf of providers, on behalf of the fantastic care that they've received or a loved one has received. They want to give back in some way, and there's many people who do that.
You must have received our letter.
I might have.
Because that is the focus of our campaign this year. The theme is focused around our slogan, which is where your generosity changes lives. But we took an approach this year that is really resonating with a lot of people, and our response to our direct mail campaign so far is in triple-digit increases over the last several weeks compared to last year. But we used a very, very personal approach by telling stories of grateful patients. And we have 3 different stories that are told, and those videos can be viewed on our website. These folks have had a very personal and touching experience with their providers at Gunderson, and they're telling their story as to why they give. And it's because of the amazing, compassionate care that they've received here, and they want to give back. Research shows that giving back is part of the healing process. People are so grateful they want to do something. We all know what it feels like. If somebody does something extremely good to us, we want to give back. And it makes us feel good. And so we're seeing that our patients are so grateful, and they really want to do something to support the organization. And quite frankly, if it wasn't for grateful patients and philanthropy, there's so much that we would not be able to do here. It's it's quite amazing.
We're talking with Chief Development Officer Robin Tanke from the Gunderson Medical Foundation about the Giving Campaign. Can you tell us a story about somebody who has donated on behalf of a provider, on behalf of the care that they or a family member has received?
Sure. Actually, I'm going to tell you a story that this story is not part of our campaign, but it's fresh in my mind because it just happened within the last couple of days. But a story about a woman in one of our rural communities who left a significant gift in her estate, and we didn't realize that until she had passed on. But the story that was told by her personal representative was that she and her brother had received their care here for years, and prior to that, their parents had received their care here for years. It had made such an impact on their lives that they made the decision a long time ago to leave this gift in their estate when both she and her brother were gone. It's a very significant gift for research, but it shows that there are grateful patients out there that we don't know about. It's their legacy that's going to continue our work, and that happens all the time. But another story that is part of our campaign is the story of a gentleman who lost his wife to lung cancer, which is and can be a devastating disease. And she was diagnosed at a late stage, and Dr. Edel and Dr. Jumonville took care of her here at Gunderson. And he is so grateful for the time that he had with her, even though sadly she has passed away. But the extra care that our physicians went to take care of her, the story is quite amazing because she had a bucket list of things that she wanted to do, even though she knew her time was short. And our physicians and caregivers made those things happen for her by doing just extra things and making sure that travel was comfortable for her and so on. So her spouse is just so grateful, and he gives back in a number of ways. He not only makes contributions in support of our lung cancer research, but he volunteers here now. He's on our lung cancer awareness task force, and he's just giving back in a lot of ways, and it makes him feel very good to do that. So it's a very heartwarming story.
It must feel like, in some ways, like a lot of responsibility for you and your team. It's not only sharing that story, but it's also when that gift comes in to make it
absolutely
valued.
In that perspective, yes, absolutely. We do make sure that every penny that comes into the foundation is used as it is intended to be used. I believe that we provide great stewardship back, and if we want people to know how their gifts are used.
Now, this isn't a knock on other charities or other places that people will donate money, but having that money be local is a big deal for a lot of individuals who decide to donate to the foundation as well.
That's very true. One of the things that we're extremely grateful for are the organizations in this community that support our work. And again, I am going to talk specifically research because that's part of the core of our mission. But there are a number, 5, 6, 7 organizations in this community that work very, very hard to raise money. The Living for Liz organization, Hope Lives, the Sparta Area Cancer Support Group, the Greater Richland Area Cancer Elimination Group, Hillsborough Cancer Elimination Group. There's a number of them that do events, walks, Fools 5 in Lewiston, Minnesota. And they do a number of fundraisers throughout the year. And then they give part of their proceeds to us because they know the important work that we're doing here is benefiting our patients and families and communities in our area, and that those dollars are not going to national organizations where sometimes you don't see what the results are of those gifts. And I call it neighbors helping neighbors. Our friends in our communities are helping us here so that we can give back and help our patients.
Well, we've been talking about the campaign. How do people participate in the campaign?
Well, my phone number, actually you could go onto our website, which is the Gunderson Health System website and Gunderson Medical Foundation, and you can make a gift simply online. We just finished our Giving Tuesday, part of a national effort, and I was just reading this morning in a blog that Giving Tuesday campaigns across the country were up over 25%. So more and more people are giving online, and it's a very easy way to do so. You can call our office, and we're happy to take your gift over the phone, or you can just call for more information, and I'm happy to talk with anybody about how to direct their gift.
Great points. That's certainly true, and of course, a lot of people want to do that before the end of the year, and thus the idea, I think, behind the end of the year campaign.
Yep, it's been a great year so far. We're again, I use that word grateful, but we're super grateful for the support that we get. Our campaign is up over 300% for the month of November compared to last year. People are in a giving spirit. And of course the economy is doing very well right now, so that helps. But I think people just want to support local organizations and feel good about what they do.
Robin, we're out of time, but we really appreciate your the giving campaign, and good luck with the campaign as we head towards the end of the year.
Thank you for having me.
All right, if you'd like to learn more about that, again, that's Chief Development Officer Robin Tanke through the Gunderson Medical Foundation. If you'd like to learn more about the campaign, as she said, go to the website, gundersonhealth.org. Plenty of information there, and I'm sure they'd be happy to reach out to you in any way, shape, or form that you'd like. When we come back, we'll talk with the director of the Jacob Wetterling Resource Center about how you can give and about the 11 traits of Jacob. That's next on It's Personal, brought to you by Gunderson Health System.
Unless you're from Ethiopia, you won't fully understand this, but you might gather that 9-year-old Abo is excited. Thanks to our eye doctors volunteering with Gunderson Global Partners, he can now see his friends at the new school and a future worth living. It's just one of the ways Gunderson Health System is combining love plus medicine. Learn how you can help at gundersonhealth.org/global partners.
Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Chris Stauffer. Well, it's the season of giving, but one of the places that has seen a lot of giving this year has been the Jacob Wetterling Resource Center that's located in the Twin Cities area. A lot of people are not aware, though, that that's a part of the Gunderson Health System. Joining us to talk more about that is the director of the Jacob Wetterling Resources, and she has several other titles as well. But Carrie Christensen joins us. Thanks for joining us.
Absolutely. Thanks for having me.
Jacob Wetterling Resource Center, as I said, not a lot of people are aware that it's a part of the Gunderson Health System. How does that work?
Yeah, absolutely. So Gunderson Health System is committed to helping people stay well and be well so that they don't have to come to us for healthcare when they're not feeling well. And abuse and maltreatment is a big part of that. If we can prevent abuse and maltreatment, it can prevent a lifetime of health effects and healthcare costs for the people that we take care of. So Jacob Wetterling Resource Center was a nice partnership for Gunderson Health System as we look towards prevention and trying to help adults prevent kids from being abused and keep their own children safe.
And keeping safe is really a goal of the Jacob Wetterling Resource Center, which also comes under the Gunderson National Child Protection Training Center. And I mentioned that you have several titles, but that's another part of what you're responsible for. What's the work that comes out of the National Child Protection Training Center as well?
Well, our job with the National Child Protection Training Center is really to train professionals like our doctors and our nurses and our staff and teachers and judges and prosecutors and child protection workers, how they can better recognize and respond to abuse, because so many of us go to school for our specialty and nobody ever gives us a course in how do you respond that first time that someone says, I was abused.
Right. So the goal is to get those professionals that we are counting on to recognize abuse to actually recognize it.
Yeah, it's important that we don't look at every child that comes into the ER with a broken arm as they might be being abused, but instead look at the entire situation that child is in, look at the home that they're living in, look at their school performance, look at their overall health and well-being so that we can recognize and respond to the signs of abuse and know, is it a kiddo that fell in their driveway roller skating, or is it a kiddo that may be really struggling with something in their home life that needs some help from us professionals at a hospital or at a school?
I know one of the things that has gone through the National Child Protection Training Center is really training for child protective service people, individuals, and this isn't just happening in Winona, which is the base of the National Child Protection Training Center. It's happening all around the country.
Absolutely. Child protective service workers, we see a huge turnover in that line of work. It's a very stressful job with high caseloads, not enough funding, not enough staff to deal with all the maltreatment we see. Just in our area alone, we have about 1,500 cases of child abuse reported to La Crosse County in the past year or two. That numbers remain pretty consistent. We know there's a lot more than that. And if we can better educate the social workers and folks that are doing this work so that they're prepared for it and they go into it knowing what they're going to encounter, hopefully they'll stay in it and save a few more kids.
We're talking with Carrie Christensen. She's the director of several different entities at Gunderson Health System through the National Child Protection Training Center and the Jacob Wetterling Resource Center. And that was really our focus, is to talk about the Jacob Wetterling Resource Center, because there has been a lot of, I think, attention drawn to the Resource Center this year because of what's happened with the Wetterling family and the finding of Jacob recently. And that has brought some attention to JWRC. And it seems like it's been a really positive outpouring of attention.
It absolutely has. You know, the work of JWRC is really twofold. It's to provide victim assistance to those who have been abused or maltreated at any point in their life, and then also to work on that prevention aspect that I talked about earlier. We support families of missing or murdered children as well, and unfortunately for the Wetterling family, that's the camp that they fall into. But we've really taken their lead from being positive and being joyful and trying to really work together to prevent abuse and exploitation for our children. And we've really seen a lot of the community, both nationally and locally, really jump on board with that with the 11 Traits campaign. Again, taking our lead from the Wetterling family.
Expand on that, the 11 traits, how that all came about and what the 11 traits really are.
Yeah, absolutely. In the days after Jacob was found, which obviously none of us were planning for in this past year, everyone had maintained hope that Jacob was alive and out there somewhere and eventually would come home. But when we found out that Jacob had been murdered, and we had a lot of people reaching out saying, I really want to help, I want to do something, I feel really badly about this. The most touching one in the days after was a group of kids on a soccer team that said, did Jacob have a favorite number? We really want to do something with that. And we have a picture of Jacob in the office where he has number 11 on his soccer jersey. And we said, yeah, actually the number 11. And so then we started just talking with the family about what are some of the traits that Jacob really embodied that can help us create a better world for our kids and keep our kids safer. And then we've been pleasantly surprised to see youth teams, schools, professional sports teams really adopt the 11 traits. We have those listed on our website, but a few of those: be fair, be kind, be honest, be a good sport, be positive. And those are the things that we really try to live by daily as well.
It's really a testament to the Wetterling family beginning the Jacob Wetterling Resource Center in the first place, and now where it's going and where it's heading. And the response to those 11 traits has been absolutely amazing. People looking for ways to give, and this is the giving time of the year, and thus why we have you on. How can people get involved with the Jacob Wetterling Resource Center and the effort to help tide abuse and help with missing children and help in that front?
Yeah, absolutely. One of the easiest ways to do that is just living those 11 traits yourself. One of those traits is being generous. And whether that's with your talent or your time or your dollars, there's always a school that could use a positive adult mentor for children. There's always a neighborhood kid that could use somebody looking out for them. There's always a charity that could use your generosity, whether that again is your time or your talent. For us, we take the dollars that are donated to the Jacob Wetterling Resource Center and we do turn that into education in our schools. We go in and we teach kids it is never their fault if they ever encounter abuse, and we talk about having a safety net of 5 adults and how that's so important, so that if the first adult is not able to help, you always have a few more that you can go to and you can trust. We teach parents how to have those conversations with their kids, to talk about it regularly, just like we talk about fire safety. So that's what the dollars that have been donated, that we've been so gratefully accepting of this past 6 months, go towards.
A conversation that's maybe been overdue for many, many years, having those difficult conversations about with children. Certainly very interesting. Carrie, thanks for joining us. We appreciate your time.
Absolutely.
All right. Carrie Christensen, Director of the National Child Protection Training Center and also of the Jacob Wetterling Resource Center. We appreciate her time today. And we want to wish you also a happy holidays. If you'd like to give to any of these entities, you can certainly do so on the Gunderson Health System website. That's gundersonhealth.org. That's going to do it for this edition of It's Personal, brought to you by Gunderson Health System. I'm Chris Stauffer. Thanks for joining us.